figure is from your text on page 291. It is intended to illustrate the etiology and pathogenesis of acute pancreatitis. Let's look at this diagram more closely. Pancreas is a large gland located behind the stomach. It is nestled within the curve of the duodenum, the first part of the small intestine. It secretes digestive enzymes through a tube called the pancreatic duct. In the pancreatic duct, enzymes from the pancreas join with bile from the bile duct and are released into the duodenum. Normally, digestive enzymes secreted by the pancreas do not become active until they reach the small intestine. But when the pancreas is inflamed, the enzymes become activated before they are secreted. Therefore, the pancreas begins to digest itself. The most common cause of acute pancreatitis is gallstones or bile stones. These small stones can obstruct the pancreatic duct and or bile ducts, so that enzymes back up into the pancreas where they may become activated through the reflux of bile. Furthermore, the passage of stones may inflame the pancreas, initiating or exacerbating a bout of pancreatitis. Chronic heavy alcohol use is the second most common cause. While the exact mechanisms for alcohol injury remain unknown, acute pancreatitis is clearly linked to alcohol abuse. Acute pancreatitis is known to occur within hours or perhaps as long as 2 days after the consumption of large amounts of alcohol. Less common causes include overeating. The consumption of fatty foods increases the demand upon the pancreas, which can overstimulate and inflame sensitive pancreatic cells. Other less common causes of tissue injury that lead to acute pancreatitis include viral infections, drugs or medications, and abdominal trauma or surgery. Here we get a magnified view of the pancreas. It shows a ductile or branch of the pancreatic duct terminating in an acinus or cluster of acinar cells. These cells produce the enzymes for the pancreas. During acute pancreatitis, these enzymes become activated too early before they enter the duodenum, causing necrosis of pancreatic tissues. Activated enzymes may leak into the acinus itself and damage the acinar cells. Activated enzymes may also digest the elastic tissue of vessel walls. This can form large gaps and lead to hemorrhage. It may also allow enzymes to enter the bloodstream. Continued digestion of pancreatic tissues may even allow these enzymes to leak into the abdominal cavity, which can lead to further complications. Finally, these activated enzymes may begin to digest the fat cells in the surrounding pancreatic tissue, leading to fat tissue necrosis.